And I remember literally when I got hired, in training, the two things they said were most common in postal workers are carpal tunnel and rotator cuffs. But do you know how many people in my office that are now retired had to pay out of pocket because they would deny the carpal tunnel and the rotator cuff and say it's not work related? How is it not? If that's literally what I do repetitively every day.
That's just what they're able to do it because they never get the proper documentation.
Welcome to the Back to Work Melbourne podcast, where Dr. Dorfman is your federal workers' comp OWCP expert in Brevard County, Florida. In this podcast, you'll hear tips and tricks about the OWCP process, along with heartfelt patient testimonials from those we've helped get their claims approved. Tune in each week for insightful advice and inspiring stories that will guide you through your journey.
So good morning, Lanaya. How are you?
I'm good. How are you?
I'm great. So you've been a patient for a while, but we finally got you in on one of our podcasts, and you are the first person at our new podcast table. So this is brand new. So Lanaya, tell me about how we first met you.
I made a phone call in January of 2024 because I had simply just turned and felt like a pop and a burn. So because I was following Chris and Jeannie due to a previous injury, I had spoken with them and they referred me to you guys. So then at that point I called you and I spoke to Amy and then I spoke to you as well. And you basically were asking me what all I was going through. Okay. And when I started explaining it, you let me know, that is a workman's comp thing that is not out of your pocket.
Right. So was this your first introduction into the federal workers' comp system, or had you injured yourself before?
Yes.
You injured yourself before.
Yes.
How was that process? So that was an injury before we knew you and,
right.
and any of that kind of
stuff.
That
was like 2021. I tore a ligament in my ankle.
Okay. So like 4 or 5 years ago.
Yes.
Okay. And how was that process, navigating through the paperwork and the doctors and everything?
That was terrible. I hurt myself May of 2024. My first appointment was July 7th. My first MRI was September 7th, and my surgery was December 29th.
Wow, all those months gone by for that injury and scar tissue to accumulate and to make the injury even worse and worse.
Absolutely.
Were you going through your federal workers' comp insurance, or were you going through your health insurance?
For that one, I was going through my
health insurance.
No, workman's comp.
Okay.
But then later, when I contacted you, I had previously been going to the doctor because I was my hands would always go numb and my arms would ache and my neck and in between my shoulder blades was the worst. So I was seeing a sports medicine doctor through my medical insurance. But then when I spoke to you about it, you explained to me that, why are you paying out of pocket when you should be?
Yes, because people don't understand that there's two ways to have a workers' comp injury. There's injuring yourself on one particular occasion, like most people understand, whether you were bending down to pick something up and you hurt yourself, or you were reaching above your head to pick up something and you hurt yourself, or you were involved in a crash in your postal vehicle. But when something happens on one particular occasion, that's when you fill out the CA1. And that's what most people, almost everybody, that's what most people understand as a workers' comp injury. You hurt yourself at work on one particular occasion. But what the huge amount of the population don't understand is injuring yourself over time is still a federal workers' comp injury. And people don't understand it. A lot of people can't grasp their brain around it. What you started treating here, how's everything been? How's your stress level dealing with the paperwork? Or is there any more stress level dealing with the paperwork? Because we're dealing with it.
Right.
Okay.
And I actually do tell a lot of people that I know that are having issues to come here because of that fact.
Right.
Because that was probably the biggest problem I had getting in, getting seen, going through the paperwork, because literally if you don't have every dot and every cross of the T,
Correct.
they're kicking it back.
Correct.
I know people that have filed a CA1 when it should have been a CA2, and then they're like, why are they denying me? Well, because you did the wrong one. And I only know that because I've done it myself.
And it's not difficult. You just need to know the rules.
Right.
But there's not a rule book. Well, Chris and Jenny have a rule book, but there's not a book for you to know when you first start working there, or even when you're there for years and years. They don't tell you what to do when you injure yourself. They don't say, your supervisor doesn't say, oh, this is a CA1. Here's this form. Also, in addition to your CA1, also make sure you fill out the CA16, because the CA16 gets all your bills paid for 60 days. God forbid they tell you about that important form.
Right.
Nobody knows about that form. But unfortunately, there's not an education to your supervisor. When they become a supervisor, there's not an education on all these forms. So when you injure yourself, unless your supervisor, and I do have patients that are supervisors, so they know what to do.
Right.
But unless your supervisor has gone through this, they don't know what to do.
Correct.
And so, and you are just left in a closed door, there's in front of you, and there's just nothing to do until you meet a person like myself, luckily, and we say, we got this. We can take care of it. And now you're getting all your medical care, you're getting your physical therapy, massage therapy. Have we referred you to other doctors?
Yes. I have a spine specialist and a for my extremities, for my shoulder, for the rotator cuff and
the great thing about one of the great things about federal workers comp is, as long as you're coming in for treatment and as long as we're documenting those injuries, they will continue to pay for the different doctors. And so for us to refer you for MRIs, for us to refer you to the orthopedic doctor, now it's on us to document correctly on why we need to refer you to another doctor, but that's on us. And we document correctly on why we're referring you to another doctor, and they have no problems with it as long as we are just crossing our T's and dotting our I's. And most doctors don't do that. Most doctors, they see you really quick, and then so not only is your treatment really quick, but even the paperwork behind that is even quicker. And that's why things don't get approved, because they don't spend the amount of time. We've got our nurse practitioners, we've got our medical doctor, we've got our 3 case managers, not one, but we have 3 case managers that are always just taking care of your file and making sure everything is done correctly. And when you get something in the mail, we already got it in the mail.
Right.
And so many times patients will call me up or send me a fax message and say, hey, Dr. Dorfman, I just got this in the mail. And I say, no problem, we already got it. Not only do we get it, but our case managers that are already working on it. And then when that happens, you're getting everything that you deserve. You're getting all your treatment, your lost wages, your transportation costs paid. Do you live local?
I live in Palm Bay.
Okay, so not too far. We have patients that come from 1.5 to 2 hours away, a few days a week sometimes, and luckily those transportation costs are paid for as long as you're filling out the necessary paperwork. But of course, God forbid your supervisor tell you about the reimbursement for transportation
Funny
form.
you say that. I'm actually right now going to hit them for the 2021 because they never told me.
Sure.
Until I came here.
But you're still able to get that
Yes.
back as long as you can provide documentation, which is simply just your doctor's visits.
Yeah.
As long as you can provide that documentation, they will. Another great thing about federal workers comp is they will pay that back pay of what they should have paid you a long time ago.
Right.
Another great thing about federal workers comp.
And that's the big thing is they weren't aware. And, I think one lady mentioned it the very last, because I went back for one right before I came here. And I think she was actually about to leave the firm. And she was like, hey, do you want to take a copy of all your visits so you have them? I don't know if they pay you for it or not.
Sure.
And then when I came here, you guys said, oh, yeah, you need to fill out this form. And I was like, oh, that's great because, and then I was worried, of course, because it had been a couple of years. Are they going to be okay? And they said, absolutely, fill it out. And so that's like 2 years worth of driving to Vero Beach from Palm Bay.
That's a lot. That's a lot. So it's further than my office.
Yeah.
And are you working?
No, not right now.
Not yet. Not yet. What do you have in your future as far as treatment?
I just had the back stimulator put in.
Okay.
I had the rotator cuff surgery in November. I'm debating. I'm supposed to have the right one done.
Okay.
But he wasn't sure if he wanted to do it right away. So we're going to see what he says in the coming up visit. And then the back stimulator's only been just over a week. So I'm just waiting for them, and then it'll be back to work until we decide to do the right one, or if he wants to do the right one before I go back. And hopefully nothing else will fall apart.
If it does, we document it. And the last thing that I wanted to say is another great thing about federal workers comp, and it is the doctors. We work together. We work together. We have to work together. We have to work together because our documentation needs to all match up.
Right.
So when you go to the orthopedic doctor or when you go to pain management, we have to have those records because those records need to match up with our records. So it's not like you're going to a whole bunch of doctors and the doctors don't know what each one is doing. We do know what each one is doing because we have to all have that documentation. If we don't, then they deny it.
And I actually just went through that, because whoever takes care of the specialist didn't have, everything correct that she needed to have. She was kind of combining the cases, which mine is kind of difficult because it's my whole back.
Right.
It's like half of it is, even though the spine stimulator hits both, so it's actually two separate cases.
Right.
And they were trying to do it as one. So they kept denying it and kicking it out.
Right.
And so then I had to come here, and then Rachel was able to figure it out and tell them.
Because another good thing is when they deny something, they write down the reason. And that's great.
I remember literally when I got hired, in training, the two things they said were most common in postal workers are carpal tunnel and rotator cuffs. But do you know how many people in my office that are now retired had to pay out of pocket because they would deny the carpal tunnel and the rotator cuff and say it's not work related? How is it not? If that's literally what I do repetitively every day.
That's just what they're able to do it because they never get the proper documentation.
Right.
And that's what they want. They want documentation on the injury. And that's our specialty. That's the specialty at federal injury centers is we understand how to document your injury. There's no doubt. There's no one in the world that's saying this didn't happen at work.
Right.
But now that we all know what happened at work, you and your doctor have to prove it happened at work, but you have to prove it in the way that they want it proven. They want it proven in your medical paperwork. Right. And they don't know how to do the documentation because we know at federal injury centers, we know how to document correctly. And what documenting correctly means is at first we have paragraphs about your job. What is your job? What do you? And that all started when you first met with Amy, the case manager.
Correct.
They were putting together the first few paragraphs of here's what your job is. Your job as a carrier is to do this, and a whole 2 paragraphs of it. And then there's the paragraph of how did this injury happen. So now you got all these paragraphs, how the injury happened and how it correlates with this is what your job is supposed to be. So A caused B. And then C is the easy part, the medical examination. So you did the examination, and by putting all that together, that's what gets your claim approved. And the great part about federal workers comp is you have unlimited care. You have unlimited care. As long as you're coming in like you're supposed to, and we're documenting your injuries like we're supposed to, you have unlimited care. And for us, and when we refer you over to this doctor and this doctor and this doctor, they pay for it. They as long as you're coming in for your treatment and we're doing a good job documenting, they will pay when we refer you for the MRI. They'll pay when we refer you to that orthopedic doctor. And then when another part of your body is hurting because of this part of your body, they'll still pay for that because this was a subsequent injury because of the first. They'll pay for everything. So federal workers comp really does offer you wonderful benefits.
Oh, absolutely.
You just have to go to a place that navigates it. Correct.